Hi Alexis, my name's Michelle and I'm here to train you on how to use an Epipen in a safe and effective manner. So I'm a trainer with Lifebeat First Aid Training Company and I am going to explain how to use an Epipen by using a PowerPoint demonstration, a simulated training device, and also a authentic device as well. Now, so by the end of this lesson, you'll be able to safely and effectively administer a Epipen device, administering the medication into somebody who's having an anaphylactic reaction. Anaphylactic reaction is a severe allergic reaction to something. It could be peanuts or any other food that they might ingest. It could be from a bee sting, which is quite a common one, or any other manner of things that can cause an anaphylactic reaction, which is a severe allergic reaction.
So, and what about the bumps on somebody's like arm
like
or something?
A rash?
Is that an anaphylactic symptom?
It can be, but anaphylaxis goes further than that. It's struggling to breathe. It's the swelling of the face and the head and the throat. The first thing that you need to do is remove them from that danger. So if there are peanuts around, you need to take the patient away from the table where that food is. If there's still a bee sting, say it's on their arm, to brush it off, not to try and pick it out, because if you do that, you run the risk of injecting more poison into the body. So you need to just brush that bee sting away. Okay?
Okay.
So first thing is to remove them from that danger. Now, anaphylaxis, as I said, causes swelling. They struggle to breathe, the patient may struggle to talk, and a lot of the time, if someone does have an allergic reaction, they will have an Epipen with them. They'll have it either like in their lunch bag, or it'll be close by, or they'll say to you, try and say to you that they can't breathe, they've had the reaction, and they have the Epipen and where it can be located. Okay?
Okay.
So, now, on how to use the Epipen, we have a step-by-step guide. So if I can just direct your eyes to the PowerPoint demonstration, we'll go through it very, just have a look through it step-by-step. So, this is the same Epipen as what is on the screen there. It has a blue safety cap, and the orange end has the needle and encased. The barrel has the medication in it. This is a training one, so there's absolutely no risk to you or to any of us. There's no actual needle in this device. So,
okay.
We have the safety cap, which is the first thing that we remove. So we remove that safety cap. The other thing I should mention, and I'll show you on the authentic device, this is as a training device. The authentic device has a small window in it where you can actually see the medication inside. It will also have a batch number and an expiry date. Okay, we'll show you those on the authentic device once we've finished demonstrating with this one.
What if the device is out of date? What would you do?
If it is out of date, I would check the window to have a look at the liquid. If it's clear or slightly milky, it's still fine to use. Even though it is out of date, and if it's not like solid or it just looks really bad, it's better to administer it than to do nothing at all. You would hope by now someone's called 000 and the ambulance is already on its way. Okay, so I'd still use it rather than do nothing at all. So the saying is with these things, blue to the sky, orange to the thigh. So what we do, we've removed the blue safety cap, we put the orange end to the outer thigh, and we press it in until we hear a click. Hear the click?
Yes.
Okay. I'll just reset this so that we can go through it again. So we put the orange to the outer thigh, we push it in till we hear the click, and we leave it there for 3 seconds. 1, 2, 3, until all the medicine has discharged into the thigh. As we pull it away, you'll notice that the orange cover drops down. That's to cover the actual needle, okay?
Okay.
So then what we do, we place the blue safety cap back on, and we then give the EpiPen to the paramedics on arrival. So then the paramedics know that you've given the patient this medicine. They can see the batch and the expiry date of the medicine, and they know exactly what's happened. You can tell them what time you gave that. Okay, so how do you feel confident in actually trying to demonstrate how to use the EpiPen?
Absolutely.
Absolutely. Okay, let me just reset that for you. Okay, so I'll give you the trainer device.
Okay.
Yeah.
Okay. So.
Any questions at this stage?
Oh. No. Not right now.
Okay.
Okay. Thank you very much. Now, I will check about the batch number and the expiry date, and check to see if there's any milky bits in it, or floaty bits, or any see if it's milky at all.
Mm-hmm.
And then first, I will ensure that the patient is having an anaphylactic attack.
Mm-hmm.
Blue to the sky, orange to the thigh. I pull the blue cap off, ensure the EpiPen is in a fist, is in my fist, clearly like this.
Yep.
On the outer thigh.
Yep.
Press in for 3 seconds, for you to hear the click, and then release, ensuring the orange cap covers the pen, the needle, sorry.
Mm-hmm.
And then you put the cap back on, and you give the EpiPen to the paramedics.
Fabulous. Fabulous. So do you remember what the saying was that I mentioned earlier? How to remember which end goes where?
Blue to the sky, orange to the thigh.
Very good. Awesome. That's fabulous. Okay. Now, I'll just pop this one here for the moment, and we'll go through it again in a minute. But what I will do is I will show you the authentic one. So what we've got here is an orange insulated case. You'll see all the insulation in there. So if you were going to go to the zoo or something for the day, and let's say it's a 35-degree day, you'd have this, and you would have it in a insulated lunch bag, because it does have to be kept cool, but it does not have to be kept in the fridge. It's no good being out and about and you've left this at home in the fridge and you have an anaphylactic shock. So you actually need to have it on you to be able to use it. So now the actual EpiPens come in a secure container so that it can't accidentally, you can't do anything with this while it's in the container. So you flip the lid, and that is an actual EpiPen. So you can now see the window there. Okay, and you can see the batch number and the expiry date. So I'll just give that to you. Nothing can happen unless you remove the safety cap, and we're not going to be doing that with this one. So what is the expiry date on that one?
May 21st.
Okay, and what does the medicine in the window, how does that look?
It does look a little milky.
It looks a little milky.
Yes.
So what would you do in that case? Would you use that, or
If the person having an anaphylactic shock gave it to me, then yes, because it's better to use it to use something than do nothing.
okay, fabulous, awesome. That's really good. So I'll pop that one back in its case, and I'll pop that away. Now, can I ask you to once more demonstrate to me how to use the Epipen?
Absolutely. So of course, ensure, look through the window, look for the expiry date, ensure blue to the sky, orange to the thigh, ensure they are having the anaphylactic attack. Remove the blue cap and ensure it goes to the outer thigh. Hear the click, 3 seconds, and then out, ensuring the orange tab is out and it's covering the needle, and then hand this to the paramedic.
Okay, pop the blue safety cap back in so that everybody knows. Fabulous. That's really, really good. Okay, so I know you get nervous doing a paper-based test, so I'm just going to ask you a few questions and then I'll conclude the lesson and then we'll be done. So, okay, so the Epipen, how long do we hold it to the thigh for once you've removed the safety cap?
3 seconds.
3 seconds, okay. So, if I was to go like this, what would happen?
Nothing, because you've got the blue to the thigh and the orange to the sky, and it's actually the orange to the thigh, blue to the sky.
Very good, very good. Okay, and what are the signs to look for someone having an anaphylactic reaction?
Some of the signs is head popping up, or someone struggling to breathe, and also their neck and their face starts to swell up as well.
Okay, and they're saying to you that they've had an allergic reaction.
Yes.
And so what is the first thing that we do when we see someone like that?
We remove them from the area that they're in. So if they're having an allergic reaction to the let's just say nuts, for example, we remove them from the area. Or if they're having an allergic reaction to the bee sting, we brush it off. We never pull it off to ensure that it's actually it doesn't the poison doesn't go into the skin anymore.
Very good, awesome. So today we have I've instructed you in how to use an Epipen. So do you feel confident that you would be able to use an Epipen safely and effectively by the training that I've given you today?
Absolutely.
Okay, that's wonderful. So in conclusion, today this lesson has covered how to use an Epipen and how to inject the medication safely and effectively. Do you have any feedback for me as a trainer? Do you have anything that you'd like that I could have done better or explained better?
No, you were actually amazing. You did a great job, and thank you very much for teaching me how to use an Epipen.
Okay, wonderful. Well, Alexis, thank you very much for your time, and I hope that you, if you ever come across someone having anaphylactic shock, that you are confident in and are able to do what I've taught you today. Okay?
Thank you very much.
Thank you.